Has your skin ever felt itchy, extra dry, or changed color without reason? You might think it's the weather, stress, or a bad reaction to soap, but what if it's something deeper? Sometimes kidney problems show up on your skin before anywhere else. By the time these signs are easy to notice, whether it's dark patches, strange nail lines, or unexplained swelling, you won't believe, but these aren't just surface-level problems. They're signals. In this video, we'll look at 9 specific skin changes that may be tied directly to kidney damage. It's not a hype, just clear, proven facts to help you catch early signs and take simple steps in the right direction. So let's begin with number 9, nail disorders. You might look at your hands every day without giving them much thought, but your nails can reveal more than you think, especially when it comes to your kidney health. While most people check their skin or energy levels for signs of illness, your nails could be one of the first places where trouble quietly appears. Let's talk nail changes. If you've noticed unusual lines, color shifts, or tiny streaks under your nails, it's not something to brush off. Studies show that around 60% of people living with chronic kidney disease experience visible changes in their nails. One common example is Mies lines, single white horizontal bands that run across the nail. These can show up due to low protein levels or stress caused by kidney dysfunction. Then there are Merkes lines, which are multiple white bands that may look similar but suggest different underlying issues tied to blood protein levels. Another common sign is what's called half-and-half nails, also known as Lindsay's nails. These nails look like they've been dipped in 2 colors. The upper half turns brown, while the lower half stays pale or pink. This contrast comes from changes in melanin and blood flow, both of which are affected when the kidneys aren't working as they should. But there are more subtle signs too, and tiny red or brown streaks called splinter hemorrhages can appear under the nails when small blood clots damage the capillaries beneath. These might look like you accidentally bumped your hand, but if they show up often, that's worth paying attention to. The good news, you don't need to panic, but you do need to pay attention. Nail changes alone aren't a diagnosis, but when they show up alongside fatigue, swelling, or changes in skin tone, they can be a useful signal. Keeping your nails trimmed and moisturized is a good start, but it's just as important to get your kidney function checked if you're seeing more than one of these signs. Number 8. Blisters. Not from a burn, not from new shoes, just suddenly there. Most people don't connect random blisters to kidney problems, but when your body's filtration system isn't working right, strange things can start happening, and your skin might be one of the first places to show it. Blisters aren't always a result of friction or heat. In people with kidney damage, they can show up without warning, often on the backs of the hands, forearms, or feet. In some cases, they even appear on the face. These are fluid-filled sacs that can be small or large, and while they may look harmless at first, they're often more than skin deep. In people with kidney disease, blisters can be caused by a buildup of toxins the body can't properly eliminate. They've also been linked to certain medications, poor nutrition, and even alcohol intake factors that further stress already weakened kidneys. These blisters aren't just uncomfortable. They often come with redness, swelling, and pain, and when they heal, they tend to leave behind scars or discoloration, making the skin look patchy or damaged. The real issue isn't just the blister itself, it's the reason behind it. If you're getting blisters regularly without an obvious cause, it could mean that waste is building up in your blood, your medications are causing skin reactions, or that your body is lacking key nutrients, all of which tie back to how well your kidneys are doing their job. These signs may seem small, but they're your body's way of speaking up. And when your skin starts to react like this, especially if you're dealing with other symptoms like swelling, fatigue, or skin dryness, it's worth paying attention. Kidney issues don't always shout, they whisper. And sometimes, they whisper through something as simple as a blister. So before you brush it off as a skin thing, think deeper. Your body might be raising a quiet flag, and the skin is just the surface. Let's look at what else could be showing up next. Number 7. Hair disorders. Before you blame it on stress or weather, there's something deeper you might want to consider: your kidneys. While most people connect hair loss to things like hormones or bad hair care habits, kidney problems can quietly mess with your hair in ways you'd never expect. Hair loss, or alopecia, is much more than a cosmetic issue. It often starts with what's happening inside your body. When your kidneys aren't working properly, they struggle to regulate essential nutrients. This can lead to low levels of iron and zinc, two minerals your hair needs to stay strong and grow normally. Without them, hair becomes thin, brittle, and dry, making it break or fall out faster than usual. There's also the hormone factor. Your kidneys help manage key hormones, and when that balance is off, your hair growth cycle can get disrupted. This can result in increased shedding or even visible bald patches. It's not always gradual, and it's definitely not always just aging. Medications prescribed for kidney conditions, including certain blood pressure drugs and immunosuppressants, can also cause hair to thin out over time. And if you're undergoing dialysis, dehydration becomes another issue. The lack of moisture in your body can strip natural oils from your scalp, leaving your hair dull and prone to breakage. Beyond the physical side, there's the emotional impact. Losing your hair unexpectedly can really affect your confidence and well-being. But the important thing is not to ignore it or assume it's normal. If you're seeing more hair on your pillow, in your comb, or down the drain, it's worth taking seriously, especially if you have other health concerns. The smartest move is to speak with a healthcare provider who understands how kidney function connects to things like nutrition, hormones, and hair health. Because sometimes what's falling out isn't just hair, it's a signal your kidneys need attention. Number 6. Dry skin, aka cirrhosis. If your arms, legs, or hands feel tight, itchy, or flaky all the time, even without changes in weather or products, your kidneys could be trying to tell you something. Dry skin, also known as xerosis, is one of the most common skin symptoms in people dealing with kidney problems, especially those going through dialysis. But here's the thing, it's easy to overlook because it doesn't seem like a big deal at first glance. When your kidneys aren't filtering waste and balancing fluids properly, it can throw off your body in subtle ways, including how your skin behaves. One major cause of dry skin is poor hydration, but that's not all. People with kidney damage often have decreased sweat gland activity, which means their skin loses moisture more easily. Long-term use of diuretics, often prescribed for high blood pressure or fluid retention, can also dry you out. Add high levels of vitamin A into the mix, which can build up when the kidneys aren't doing their job, and you've got the perfect storm for dry, cracked, and rough skin. Now, this isn't just a cosmetic issue. When the skin becomes too dry, it can crack. And once that protective barrier is broken, it's easier for bacteria to slip in, leading to infections. If your skin feels tight and itchy all the time or starts to peel and flake no matter how well you moisturize, it's worth taking seriously. It might not be just dry air or a soap reaction. It could be a sign your kidneys are under strain. Even if you're already on dialysis, this symptom can still persist. In fact, 50 to 80% of dialysis patients experience xerosis at some point. So if you're noticing dry patches more often, or your skin just doesn't feel the same as it used to, don't ignore it. Managing your hydration, avoiding hot showers, and using gentle fragrance-free moisturizers can help, but the root cause still needs attention, because what's happening on the outside could be reflecting a much bigger issue on the inside. And as we move forward, there's another change in your body that could be tied to kidney function. It might even be hiding in plain sight. Number 5. Swelling. You might think it's just from too much salt or sitting too long, but your kidneys could actually be behind it. When your kidneys stop doing their job properly, one of the first things that shows up is swelling in places where fluid doesn't belong. And if you're noticing this kind of puffiness often, it's time to pay closer attention. Swelling, also called edema, is your body's way of showing that fluid is building up instead of being filtered out. Healthy kidneys flush out extra water and salt. But when kidney function starts to drop, that process slows down. The result? Water and sodium stick around in your body, collecting in soft tissues like your hands, feet, ankles, and even your face. It's not just a cosmetic issue, it's a sign your filtration system is struggling. One simple way to check if you're dealing with fluid retention is to gently press on the swollen area with your finger. If it leaves a dent that stays for a few seconds before fading, that's what doctors call pitting edema. And while it might sound harmless, it can be a signal that your kidneys are under pressure and failing to maintain fluid balance. What makes this tricky is how often people ignore it. Maybe you think your shoes are just too tight today, or that you slept funny on your face. But if swelling shows up regularly, especially in combination with other changes like fatigue, dry skin, or changes in urination, it's worth checking in with a healthcare provider. It's not just about reducing the puffiness, it's about finding out why it's happening in the first place. The good news is that early detection makes a difference. If swelling is caught early and linked to kidney issues, your doctor can help guide you through the right tests, treatments, and lifestyle changes to manage it before things get worse. Because sometimes, what seems like a small change on the outside is your body trying to wave a flag. And as we continue, there's another skin sign that could carry just as much weight, and you might not have even noticed it yet. Number 4. Calcium deposits. Most people wouldn't think to connect those to their kidneys, but they actually can be a big red flag. When your kidneys aren't filtering minerals correctly, things like calcium and phosphate can start building up where they don't belong, and your skin might be one of the first places to show it. One serious condition linked to this is called calciphylaxis. It's rare, but when it happens, it's dangerous and needs immediate attention. Calciphylaxis usually shows up in people undergoing dialysis and happens when calcium builds up in the small blood vessels of the skin and fat. This blocks blood flow and causes painful, deep skin sores, often on the abdomen, buttocks, or thighs. The sores usually crust over with black scabs and don't heal easily. They can also be extremely painful and increase the risk of infection. Another condition to watch for is calcinosis cotis. This is when calcium collects just under the skin, often around joints like the elbows or knees. It looks like firm white nodules, and sometimes those lumps can break through the skin and leak a chalky white discharge. Unlike calciphylaxis, calcinosis cotis is usually less painful, but it still isn't something to ignore. Both of these skin issues are signs that your calcium and phosphate levels are out of balance, which is often linked to kidney failure or problems with how your kidneys are managing minerals. The buildup of these substances doesn't just affect your blood, it can move into your tissues, your bones, and yes, even your skin. What makes these conditions tricky is that they often show up in people already being treated for kidney disease. So even if you're on dialysis, these are symptoms to take seriously. They don't just go away on their own and need professional medical care. So if you notice painful sores, black crusted ulcers, or unusual hard white bumps near your joints, don't wait it out. These may be your body's way of warning you about something deeper. Number 3. Itchy skin or pruritus. Not the kind that shows up after a mosquito bite or a dry winter day, but the kind that lingers and drives you up the wall. If that sounds familiar, and you're dealing with other health issues, it could be more than a skin problem. It might be your kidneys trying to get your attention. Chronic itching or pruritus is one of the most frustrating and overlooked symptoms of advanced kidney disease. Nearly 40% of people with end-stage kidney failure experience this type of itch, and it's not just a minor inconvenience, it can seriously affect sleep, focus, and quality of life. What's causing it? A buildup of waste products like urea in the bloodstream. When the kidneys can't clear these toxins properly, they start to show up in the skin, triggering relentless itchiness. This kind of itching can strike anywhere, but it's especially common on the back, arms, and legs. And unlike normal itching that goes away with lotion or a quick scratch, uremic pruritus tends to stick around and gets worse with heat, sweat, or dry skin. It's often most intense at night, making it hard for people to get restful sleep. The problem doesn't stop at the itch itself. People with this condition often find themselves scratching constantly just to get a bit of relief. Over time, this can cause even more damage, leathery patches of skin known as lichenification, raised itchy bumps called prurigo nodularis, and even open sores or bleeding. Once the skin barrier is broken, the risk of infection climbs fast, especially in those with weakened immune systems. So if you're scratching more than usual and there's no obvious cause like allergies or detergent, don't brush it off. Persistent itching could be a sign your kidneys are struggling to filter out what your body doesn't need. It's always better to check early and know for sure than to wait until the damage goes deeper. And remember, itchy skin is just one way kidney disease speaks up. There's another sign that shows up right on the surface, but it's often mistaken for something completely different. Let's take a closer look. Number 2. Skin discoloration. Not just tired or pale, but maybe dull, yellowish, or even gray toned. If your skin color has started to shift and you can't blame it on lack of sleep or the lighting, it could be more than a surface level issue. It might be your kidneys trying to get your attention. When your kidneys aren't working properly, they can't filter out waste the way they should. Those toxins hang around in your blood and your skin pays the price. One of the most noticeable effects? Discoloration. You might see your skin take on a gray or yellow hue, and it's not something makeup can cover. It happens because waste builds up in the body instead of being flushed out. Another sign to watch for is hyperpigmentation, which shows up as dark patches caused by extra melanin, something that can increase when kidney function declines. On the flip side, some people develop pallor or paleness, especially if kidney disease leads to anemia, a condition where your blood lacks enough healthy red cells. And then there's uremic frost, a rarer but very clear warning sign. It looks like a fine white powder on your skin, caused by excess urea that comes out in your sweat and dries there. This can appear on the face, arms, or anywhere else sweat collects. If your skin suddenly looks different in tone or texture and you can't pin down a reason, don't ignore it. Your kidneys might be sending out one of their clearest signals yet. And just ahead, there's another surprising place where these warning signs tend to show up. It's something most people check every day without realizing what they're really looking at. Number 1. Rashes. If you've been dealing with itchy, rough patches of skin that come and go without a clear cause, it might not just be a reaction to a new soap or detergent. These types of rashes can actually be your body's way of warning you that your kidneys aren't doing so well. When your kidneys aren't filtering waste properly, those toxins can start to show up in your skin. One way this happens is through itchy, scaly rashes that just won't quit. There's a specific condition called acquired perforating dermatosis that often shows up in people with serious kidney problems. It creates pigmented bumps with a scaly center, usually on the arms and legs, but they can also appear on the scalp, trunk, or buttocks. What makes these rashes even more frustrating is how they come and go. You might notice old ones healing while new ones show up nearby. They often exist in different stages at the same time, and the itching can be intense. But here's the warning: scratching these spots only makes things worse. Not only can it cause inflammation, but it also increases the risk of infection, especially if your skin breaks open. If you've been noticing these kinds of rashes along with other symptoms like swelling, fatigue, or dry skin, it could be time to consider what your kidneys are trying to say. A persistent rash with no clear reason is worth checking out, especially when it's showing up in multiple places or keeps coming back. If your skin's been itching, swelling, or changing color, it might be more than just a surface issue. These 9 signs are often your body's quiet way of pointing to kidney stress, especially if you also have diabetes, high blood pressure, or are over 60. Don't ignore what your skin is telling you. A quick visit to your doctor, along with simple blood and urine tests, can make a big difference. And remember, small steps like better hydration, skincare, and healthy eating go a long way. If this video helped you spot something new, hit like, share your thoughts in the comments, and make sure you're subscribed so you never miss an update. For your information, this content is for general education only and based on trusted sources. If you're feeling unwell or noticing symptoms, please speak with a healthcare provider. Thanks for watching.